Pediatric Radiology last-minute flashcards. A preterm infant born at 32 weeks gestational age presenting with respiratory distress. The newborn was intubated, and as you see in the chest X-ray, there are diffuse granular opacities obscuring the vascular markings. And you can see here the bronchogram, air bronchogram. What is the most likely diagnosis? Surfactant deficiency disease or respiratory distress disease. Classically, before intubation will be a lower lung volume due to alveolar collapse. A newborn infant with heart murmur and limb abnormalities presenting with difficulty feeding and inability to pass a nasogastric tube. On a chest X-ray, you will see here the nasogastric tube stopped here. Normally should go all the way down to the stomach, but stopped here. And during surgery, a contrast or enteric contrast was injected retrograde via gastrostomy. And as you see here, the contrast stopped, terminated here in the lower esophagus. What is the most likely diagnosis? The long gap esophageal atresia, long gap esophageal atresia with tracheoesophageal fistula in the setting of vectoral association. To remind you, with vectoral association, vertebral defects, anal atresia, cardiac defects, that's why the murmur in the newborn, tracheoesophageal fistula, renal anomalies, and limb abnormalities. Suspect this case in any newborn with respiratory distress and inability to pass the nasogastric tube. A newborn infant presenting with cyanosis, arrhythmia, and hollow systolic murmur. As you see in the X-ray, the heart here is markedly enlarged and box-like shape. What is the most likely diagnosis? Ebstein's anomaly. Suspect Ebstein's anomaly in any newborn presenting with cyanosis, and the chest X-ray shows markedly enlarged heart, taking most of the chest box shape due to asymmetric enlargement of the right side of the heart. This is because of a defect in the tricuspid valve. A 3-year-old girl was diagnosed with influenza A. A few days later, she started having very high fever, respiratory distress, and tachypnea. Chest X-ray showed extensive left lung pneumonia with a small cavity. Antibiotic was started. 3 days later, the chest X-ray showed less consolidation in the left lung with a larger size cavity. CT scan was ordered 15 days later and showed complete resolution of consolidation and thin-walled cavity. What is the most likely cause? Staphylococcus pneumonia, commonly associated with cavities, and also is a common complication after infection with influenza. A 12-day-old infant with a historic prematurity presenting with abdominal distension. This is the frontal X-ray or frontal supine, and this is cross-table. As you see here, the abdomen is distended. You have distended fistularis bowel loops, and also you can see intramural lucences here, intramural lucences. And if you focus here, you will see gas in the portal veins. What is the most likely diagnosis? Necrotizing enterocolitis. Intramural lucences means pneumatosis intestinalis, and this is a pathognomonic for the diagnosis of necrotizing enterocolitis. Presence of gas in the portal veins is a bad prognostic sign. 2-year-old child presenting with throat pain. Chest X-ray was ordered, and discoid metallic foreign body found in the upper esophagus. On the frontal view, as you see here, the front of the foreign body, the round circle, and the edge was found in the lateral view. This means in the esophagus. The question here, is it simple coin or button battery? Button battery ingestion. Why button battery, not a simple coin? Because button battery, it has double edges. And if you look closely, you will see a slight step off along the edges of the foreign body. This means button battery, not a simple coin. This is an emergency, has to be removed immediately. A 12-year-old male with ankle pain after a basketball injury. The frontal view here is showing radiolucency in the metaphysis of the tibia, and also is showing here more obvious radiolucency in the metaphysis of the tibia, widening in the physis as you see here, but the epiphysis looks normal. What is the type of fracture? Salter-Harris 2 fracture. I will go over the types of Salter-Harris fracture in the next two slides because it's extremely important. Know the classification of Salter-Harris injuries by heart. Is a high yield, commonly tested in the board and also in real life encounters, very important to know. This is normal, this is the metaphysis, this is the growth plate, and this is the epiphysis. Here, type 1, you have intact metaphysis, intact epiphysis, but you have fracture through the growth plate. If it's displaced, the diagnosis will be easier. If it's not displaced, the diagnosis can be difficult. But type 1 is the fastest one to heal and the complications are rare. Type 2 is the most common type, is about 75%. You see here fracture in the metaphysis as you see this piece, and fracture through the growth plate, but the epiphysis is intact, is type 2. Type 3 is less common. The metaphysis is normal. You have fracture in the growth plate going through the epiphysis. You have fracture in the epiphysis, but the metaphysis is intact. Type 4, you have fracture in the metaphysis, and the fracture will go through the growth plate and will pass to the epiphysis. This is this type of Salter-Harris injury is well known with complications. Like for example, if it's not treated properly, will cause growth arrest or angulation of bone. Type 5 is rare, and this is the worst prognosis, and is a fracture in the growth plate, but with compression or crush injury to the bone, with no fracture in the epiphysis, no fracture in the metaphysis. This is the worst prognosis. Type 3 and type 4 commonly will require internal fixation and surgeries to correct the injury and also to prevent complications. Again, to emphasize, because it's really important and is a high yield, this is normal. Type 1, you have intact metaphysis, intact epiphysis, and a fracture in growth plate. Type 2, you have fracture in metaphysis, growth plate, but you have intact epiphysis. Type 3 is the opposite of type 2. You have intact metaphysis, fractured epiphysis, and growth plate. Type 4, you have fracture in metaphysis, growth plate, and epiphysis. Type 4, no fracture in the epiphysis, no fracture in the metaphysis. You have fracture in the growth plate with compression or crush injury. The higher the number, the worse the prognosis.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.
This is the end. Thank you.